evening, ladies and gentlemen. I'd like to talk to you about an epidemic happening in rural America, but before I get started, I want to share a story about my sister, Samantha. She dreamed of being a top model, and when she moved to New York, she was diagnosed with increased asthma inflammation. Upon further review, she discovered that when she was diagnosed, she had stage 2 breast cancer. And I saw my sister go from this vibrant young lady right here to this picture in all of a year and a half. And I saw what the cancer did to my sister, and I said to myself, I'm going to make it my mission to provide early risk detection of symptoms of women for any medical condition. Hi, my name is Veronica Berry. I'm founder and CEO of TruDiary, utilizing AI to improve the delivery of accurate care for women. So 12 million Americans are misdiagnosed each year, and women are 50% more likely to be misdiagnosed for any medical condition. And that's due to lack of access to care, lack of patient engagement, and information health gaps. So we're building an AI-powered early risk detection platform that gives the likelihood if a woman is at risk for any medical condition. So here's how it works. A woman downloads the app, she enters her health information. Based on data sets within our algorithm, what happens is the system is designed to give the probability of risk for any medical condition. So as we were researching the $39 billion reproductive market, what we found, it didn't matter what health condition it was, women were still 50% more likely to be misdiagnosed. That number grew when we talked about pregnancy. So we're starting with the $300 million high-risk pregnancy market in Georgia. And you look at this map, what you'll find is 79 out of 159 counties are without OB wards. What that means is that the closest OB to a young lady is 60 miles. There are even some counties where 50% of middle-aged and high school girls miss on average of 61 days of school. And some counties where there's only 2 OBGYNs per 13 county area. I want you to think about that for a minute. We're in 2019, and this is going on in rural Georgia. So just think about how many other states this is happening with. So we are a by women, for women solution that's gaining a lot of traction. And unlike others who have really tried to solve this problem, we're really at the forefront of solving this problem. And as you can see, what really differentiates us, as you can see on the screen, it's really change. And so that's what we want to emphasize today. So what we're doing, we're focusing on provider organizations who are really have financial challenges in this area as far as access to care, and really partner with the federal government to solve this problem. Our B2B model is a licensing agreement with a per patient fee that's reimbursable by insurance. And our strategy, we're really focused on a qualified funnel of direct sales through networking, conventions, and strategic partnerships. So how did we get here? We started a 100 women beta, and what we found over a 3-month period, our matrix was we wanted to look at fitness and we wanted to look at menstrual cycles. On average, the women were on our app for 4 days. For the week. And what we found is 90% of our respondents said that over the 3-month period that they really felt like they had a better health outcome and they really understood their health profile. That led to a 650 woman wait list, which helped us garner a partnership for developing our algorithm with the University of Mississippi Medical Center. And the reason that's important is because they're one of the premier medical centers for innovation and research and academics in the country. We also raised over $300,000, of which $75,000 was closed within the last 60 days. So the federal government is spending billions of dollars on this problem. In 2019 alone, $351 million was allocated in federal grants from the Department of Health and Human Services. So why are we the team to bring this problem or this solution to the table? We have collectively over 25 years of healthcare experience. I have over 20 years of direct sales and marketing experience with big pharma and hospital sales. My co-founder and COO, Tiffany Gray, has over 8 years of population health experience with a degree at George Washington University with an emphasis on research and women's initiatives. So what our ask is today, we are looking for investment. We're raising $600,000, of which we have half of that, but we're really looking for investment partners who really feel passionate about women's health. That's what we want to partner with. We're also looking for grant funding in the form of social impact, pitch competitions, as well as big pharma and health initiative challenges. And we're looking for strategic health partnerships where we can really partner with health systems and get those warm C-level introductions. So at TruDiary, we really believe that access to healthcare for women is a right, not a privilege. What we know is healthy women are productive with their families and community, and everyone wins when women are healthy. If you really want to make impact on women's health with TruDiary, please see me after the pitch. Thank you and good evening.